So we're going to look at rotation again. Now the patient's in supine. You can't see the full patient. I can. But what we're going to look at is rotation and options to test rotation of the pelvis. All right. Now some will talk about particular areas in the vertebral column. Some may talk about L5S1. Some may talk about vertebral regions higher. It depends on who you're encountering when speaking about this. But they'll talk about supine rotation to figure out what the pelvis is doing. Now they'll say that you can test the global rotation of the pelvis or the general rotation of the pelvis by just simply rotating a patient in supine. Now the way that you would want to do that, if you're going to even try to be reasonable about it, is to reach across so that you can use leverage. Now the problem then becomes the other side of the patient stuck to the table. You don't necessarily know what the heck is happening here. So it would look something like this, but the problem is I may not necessarily be able to palpate anything at L5S1 or anything higher. I can use visual, but I'm being tricked simply on account of the fact that the patient's stuck to the table. Now, some may say, well, use the leg as leverage. This knee is okay enough? Okay, sweet. Okay, now, look at the pelvis rotate. Look at the pelvis rotate, right? I'm saying that and being a jackass because the hip is moving a lot. I see movement here visually. The problem becomes it's not the pelvis rotating, it's the hip. The pelvis will wiggle a little bit off the table. Now, let's make it better. Okay, let's put a hand underneath, okay, and then see what the heck is happening. Now I'm in a very compromised position. I'm reaching. I'll feel that lift, and then I would want to compare it to the other side. But the problem is I'm going to feel way more of me than I am going to feel of the patient. So rotation in supine in any way is blocked by the table. Same thing in prone. Can you do it a little bit? Yes, you can do it a little bit. If you're consistent with how you do it, will you find restriction? Yes, you'll find restriction because you'll know the test well enough. The problem that you run into is it's not accurate to what you're claiming. It's not valid to test rotation, right? So we end up having a problem. The more things you move to move the area that you want to, the longer your leverage, the more confusing and convoluted your test is, the less you should trust it or trust that it's valid, right? So it's not telling you what you claim it's telling you. It's telling you something, it's just not telling you about that thing that you wanted to tell you about.